Good afternoon, everyone. I'm Rachel Grant. I'm a PhD candidate at University of Ottawa's Faculty of Education, being supervised by Dr. Doug Archibald and Dr. Angus McMurtry. I am studying rural primary care providers learning from eConsults, which I'm going to be talking about in this video. And prior to going into academia, I was a primary care nurse. So the focus of my dissertation is education, eConsults, and rural health. So in Canada, approximately 18 to 20% of the population lives in rural areas, and rural communities face a number of health disparities such as difficulties accessing care, shorter life expectancy, and just generally poorer health status. And this is a topic I am very passionate about. Quite a bit of my family lives in rural Canada, and I grew up watching them face various barriers to accessing care. And I myself now live in a rural town where primary care and going to the emergency room are the same thing. But as someone who now works in education, the issue that I'm most interested in is barriers that rural healthcare professionals can face when they're trying to access continuing professional development, or CPD. Just as rural patients can have issues trying to access their own healthcare, rural healthcare professionals can have issues accessing CPD. And I think that eConsults present a really unique opportunity here because they've been found to have educational value. For example, they can enrich practice-based learning and inform CPD. However, this intersection between learning and eConsult has yet to be explored specifically within the context of rural primary care. So that's what I've set out to do in my PhD. So my overarching research question is, how do primary care providers in rural Canada experience learning through eConsults? And within this, I have 3 sub-questions. So the first question is, what is the breadth and depth of the literature pertaining to eConsults for rural primary care providers? How do rural primary care practice and learning intersect within this body of literature? How is the Champlain-based service specifically used by rural PCPs here in the Champlain-Lynn, where I live? And is there evidence of learning provided? And how do rural primary care providers in the Champlain-Lynn access their CPD? And I'm tackling all of this with a multi-phase mixed methods design. So my study has 3 phases. So in our first phase, we are doing a scoping review examining the breadth and depth of the eConsult literature, particularly with regards to PCPs learning rurality and how these 2 concepts intersect within the literature. And I have a virtual poster presentation that anyone can view if they want to learn a little bit more about this specific methodology. I'll link it up here somewhere. Phase 2 is a quantitative analysis examining eConsult usage by rural primary care providers that use Champlain Base. This will be a combination of descriptive statistics as well as some planned comparisons between groups. For example, nurse practitioner versus family physician. And we'll also be looking at the closeout survey. Phase 3 is a qualitative exploration of rural primary care providers' perspectives on their eConsult usage, their access to CPD, and the intersection between eConsults and CPD. And this will consist of semi-structured interviews with our rural PCP-based users. Ultimately, the findings of phase 1 and 2 are going to be feeding into the subsequent phases. For example, perhaps something pops up in the scoping review that we hadn't even considered when drafting our protocol, and we may then want to revise our interview script. And I am doing my dissertation by article, which means rather than the traditional really long monograph that you often see associated with a PhD, I'm writing a series of 4 manuscripts centered predominantly around the 3 research questions. And the first article is now done and submitted, and this first article delves into the theoretical framework that we have developed for exploring primary care providers learning from eConsults. And with that, I will wrap things up here. Thank you everyone for taking time out of your day to listen to my project.